Welcome back to the Disability Squeeze, where we uncover the hidden costs of living with a disability and explore real solutions to make life more affordable and equitable for everyone. I'm Dr. Zach Morris, an associate professor at Stony Brook, and today we're joined by Carrie Leljedal, a family caregiver turned advocate with both small and big ideas for making our communities more inclusive and financially sustainable. I think you'll get a lot out of this conversation.
My son was born with a very rare seizure disorder called Sturge-Weber syndrome. It is a true orphan disease, so less than 1% of the general population. So, first of all, like I said, he's 37 years old. So Google did not exist 37 years ago. AOL didn't exist 37 years ago. Literally what he had was one page in a medical book at that time. So, the first expense anybody or most people with disabilities in care, in my opinion, is finding the proper care, and even if your insurance is covering the care, is your insurance covering the 500-mile trip? Is your insurance covering the hotels and the meals? And the answer to all of those we know is no.
And so you were traveling across the country trying to
Yes.
find the specialist who could really work with your son for his
Yeah,
condition.
I've done it, yes.
Yeah.
And, there's things like that or someone's like, even if it's once you found the doctor, and okay, they help you get your diagnosis. So everything my son has, it's very unique, is caused from a birthmark that penetrated his brain.
Mhm.
But he also has the birthmark on the skin, and it's a port wine stain. So port wine stains, the more you treat them with lasers, the better somebody's skin will be when they're an adult. They'll have, instead of, sometimes you've seen an adult that has these awful big bumps and things that bleed from a birthmark, because they had no treatment as a kid. So my son had lots of treatment as a kid. We lived in central Illinois. We had to go to Chicago, which is not terrible. It's still 3.5 hours, though, each way with the baby and another one, because we had another one 2 years later. And, we were young, very young parents who even affording, the trips to Chicago and back and the hotels. And Ronald McDonald houses are they're the greatest thing on earth, but they're not for a one night stay. They're meant for people who need it for expanded time, that their kids in the hospital, they need somewhere to be for a week or a month or 3 months, because I've done all of the above, So you look at those things, you look at what does a wheelchair cost? People are horrified to find out what a wheelchair costs, and even a basic manual chair, let alone getting into electric chairs. And, or even better, what happens when it breaks and you're 2 years into it and your insurance doesn't want to cover it because you haven't been 5 years yet? It should be just fine. So there's a lot of things about that world that people don't, what does it cost to modify a car?
Right. So I want to break it down too, because I think that the way that these kind of costs occur can happen differently at different time points, right?
Correct.
So it seems like early on you have this, you have a son with a disability, and you have really acute costs related to getting medical diagnoses, getting specialist care, right? And
Correct.
you're traveling across the country. I bet that's a very common situation for parents with children with disabilities, right? Trying to find medical specialists, even if insurance covers the medical specialist, which is an assumption that might not be true. Was that always true for you, that the insurance would cover your?
Back then we were very lucky. My ex-husband had great insurance, and we qualified through a program through the state of Illinois. And that was for things that I did in Illinois or like in St. Louis. Some of the specialists that I took my son to were at conferences, because they would be there and they would be seeing people for free. So then there's that charge related to it. Some of the best neurologists we ever saw in the country, I saw at conferences when I walked in with stacks of MRIs like this in my hand.
All right. So you're scrambling, right? You have a son with a rare medical condition. You're scrambling to get the right specialist care, going to conferences to get free care, getting insurance coverage, dealing with that billing, finding places to stay. And then you finally get the diagnosis.
And then we'll go to the next thing, which is prior authorizations on medication. And, we don't want him to take that brand of seizure meds. We want him to take this brand. It does the same thing. No, it does. Especially, and not everybody, some people are just fine whether they're using the name brand or the generic, but some people with seizures are not. Only one will work for them.
So this was a seizure so he needed medication to control seizures, and only certain medication worked, still does. And
that's the part of this too. So a seizure med is a great example to use for what you're doing. So seizure meds on average work for 33% of the general population that needs them. So we'll use meds that you've heard of, probably Depakote, phenobarbital, Keppra. Okay, so there's 3. So out of 100 people, 33. So you try this one and it's not working, but we want to add some of this med to it now. So there's this, also you're playing this game of what can you take, what you can't, what's the insurance going to cover? Or the best one is, well, we will only cover so much because this exceeds the recommended daily allowance or recommendation of a daily amount. When you have one of the top epilepsy specialists in the country saying, no, he needs this much. And it's that process of working through the hospital and the doctors and the insurance to get that prior authorization.
And in the meantime, are you covering those costs out of pocket?
Very seldom did I have to. Usually, a lot of times when the big part of those big components go on, you're in the hospital, so the hospital's dealing with it. But I've had points where St. Louis Children's literally was mailing us medications.
Okay.
And I won't be the only parent you'll ever hear that from. And it's not even just those. Like my son also is diabetic. So one of the most dangerous combinations you can put together is seizures and diabetes. And it's not uncommon for 1 month that this brand of insulin is covered, and the next month you're getting a letter saying, oh, we're not covering that one anymore. You need to switch to this. But don't worry, it's the same thing. Sometimes it is, and sometimes it isn't.
And were there times when you just didn't have the medication you needed?
Not really, because I learned very quick how to get ahead of the system. And I would tell anybody, and I still tell people today, if your insurance will let you, if you fill it on the 1st today, fill it on the 26th at the end of the month. Then the next month, fill it on the 22nd. And the next month, fill it on the 18th. Every month, if you can, figure out what your number of days are that you can get, because every insurance company has a lead out of 1 to 4 days. It's not as easy as it used to be.
You were able to navigate it through your savvy
to navigate it. Correct.
So, all right. So let's say, again, we had the acute costs at the time of diagnosis. Then we had these, medical related costs, and also just the burden of figuring out the right medication for your son, it sounds like. And then you have these it sounds like long-term oriented disability related costs. Like we were mentioning wheelchair costs. Were there other kinds of expenses?
Bathrooms.
Let's talk about that. You remodeled your bathrooms in your house.
So
to make them wheelchair accessible.
So we did in my old house, we got help from the state to get a bathroom done. Okay, because in the state of Illinois, depending on what programming you're in, there are some funds to help. It's limited to once every 5 or 10 years. I don't know. It's been more than 15 since we had it done. It's also very limited. Here's your dollar amount. If it works, great. If it doesn't, you're on your own after that. I mean, even probably the better example was that he was in the hospital before we did this bathroom. And when he went in, he was walking. When he came out, he was no longer walking. And my house was not accessible. And the hospital had worked with the state. Oh, don't worry. We promise, even if it's a temporary ramp, there will be a ramp on that house when she comes home with him. No, my ex-husband and my husband wound up building a temporary ramp until somebody in the family happened to give us a short wheelchair lift to put onto my porch.
Okay, so you had to do it yourself. You had to build it yourself. It was very difficult to navigate the ramps and
even the wheelchair lift we were given. Same thing. We had to figure it all out. And there's no system in place. I do a lot of advocacy across the board for disabilities and long-term care. And let's, talk about when, mom or dad broke a hip and they now, even if it's a temporary disability, and that's actually probably worse, is it's a temporary disability. So nobody wants to give you the money to put a lift on your house or make sure your bathroom, even if it's as simple as, do they have the right arms and extender on their toilet to make sure they're safe? Are we just giving them the same $49 mass bulk walker that every person in the hospital gets versus let's really look and see, do they need the walker with the brakes and the seat? And yes, it might cost $300 instead of 49, just for using easy numbers. But how much are we saving when grandma does not fall again? And there is
So
none
this
of
kind of
that.
personalized attention to needs in the home and needs for people, you think is you found really lacking in
Oh, everywhere. It still
in
is, yes.
medical discharge from the hospital and from long-term care, residential facilities. Those are the places that are making these determinations. Yeah.
Right.
Or
The
where?
places that do it the best are pediatrics. Okay. I mean,
Mhm.
we never discharged without a care coordinator out of a pediatric facility. But when you're 2.5 hours away from where that hospital is to where you live, they can only do so much. They would say to me, "Ooh,
Got it.
there's lots of times
Got
we'd
it.
run out to somebody's home, but we can't do that with yours because you're too far." And,
Because
you
you live
know,
in a rural area. Would you describe where you live rural? Is rural?
yes, yes.
Okay.
So when I was in central Illinois, I was dead center between Chicago, Indianapolis, and St. Louis. I now live in even more of a rural community of 3,500 people, but I'm 30 minutes from St. Louis now. So at least now the city is very accessible.
Okay. So as a former rural resident, I guess I don't know if you still describe where you live as rural.
Yes,
You do.
I'm in a
Yeah.
rural
So
county.
what do you what do you view as like some of the major challenges that people with disabilities face in rural communities in terms of the costs and affordability and accessibility to their kind of disability related goods and services that they need?
So first of all, no sidewalks, you know, way less sidewalks, crosswalks, stop, crossing signs, whatever. Um, especially a small rural community like this that might have 2 or 3 restaurants that were built when, and they've done what they can, but they're only can do so much. Like trying to get, a wheelchair into them is to some of them is almost virtually impossible. Like we have a diner here in the town I live in, and my son lives in a long-term care home 2 blocks from where I live. We bought the house because of his home. But my husband and I eat dinner there regularly, but we have never taken my son inside because we know they have a portable ramp, and I know how much work it is for them to get the ramp out for me to bring
Right.
him in.
And would you say that, this diner is a central gathering spot in your community, it sounds like,
Absolutely.
right? And to not be
Absolutely.
able to access it is a real kind of
Right. And,
exclusion.
and they, like I said, and they have a ramp, but they're so busy and all the rest that in my brain, partially because I ran restaurants for years, is the other thing. And the other component that nobody ever looks at with this, well, there's 2 components to it. So, first of all, he's still my child, whether he lives at home or not, he is still my child. And this is still his home. Okay. It's mom's house, it's his home. So, because he does not physically live inside my house, I qualify for zero assistance to make anything accessible to get him inside my house. So, my husband and I bought a house built in 1947. So, I'm sure you can imagine how accessible that is. About $15,000 later, and granted, part of that was our decision because we had to pour a patio to put a wheelchair lift, like the scissor ones that you see that go up and down like an elevator. So I have that on the outside of my house. And we had to have the brick cut to put a accessible door in. And when we poured that patio, we decided to pour bigger than we needed because if you're pouring a patio, you might as well pour a patio. And you have to have a patio to put the lift on. It has to be on concrete. But there is zero assistance for that.
Right.
There is
And,
because
and, and yeah, go ahead.
So the other oxymoron of it is, I also do not qualify for a caregiver tax credit because he's not living at home. Okay. Anybody who doesn't think I don't spend a fortune every year on my son is crazy, especially in a state like Illinois where your needs allowance, which means after the state takes your social security, how much do you get left to live on a month? In Illinois is $30. Hasn't been changed in ever. But if he was my parent, even if I'm living in a nursing home, I could still take a $500 tax credit. But because
Hmm.
he's my child and he doesn't live at home, I don't qualify for the credit.
I want to talk about two things here. One is it sounds like you bought the house to be close to your home, to your son, right?
Correct.
Specifically. And so where is your son now? And
So
what's the current?
he lives in what's considered an intermediate care facility for adults with developmental disabilities. The home that he's in um, is the highest acuity home in the state of Illinois that is not a state-run facility. Okay, it's local owned. Our We're not even a franchise. We're not corporate. Nothing. It's fabulous, and it's an old building that needs lots of work, but it's a home because of how it's ran. But and it's not even just that for my son. The other reason we bought the house so close is, ooh, what do you do with your neighbors? You have a cookout and everybody comes over and hangs out. One of the reasons we poured a 30 by 30 patio is because I could fit 5 or 6 wheelchairs and 10 other people on my patio all at the same time. And I do regularly. We bring other people that live there over, we bring staff over, and we hang out on a Sunday afternoon and have a cookout and relax in the backyard like you do with the rest of your neighbors. Because, like you said before, it's a community and we want them to be part of the. And this is for a very small town, this is a very ADA accessible, accepting community because of the home my son lives in and that
Right.
there's 90 people there.
90 people. And this is run by the state,
No,
or
it's private.
it's a private nonprofit
Nope, it's
agency
private for profit, even more interesting.
for profit. Okay.
And the gentleman, so it is technically it's a corporation, but there's 4 owners. They each
Okay.
own 25%. Our CEO has been there 37 years. Our director of nursing and our and our administrator have been there 25 years each. It's a home. They love this place as much as the
Okay.
rest of us. I
And
mean,
and how do you pay, or who is paying for your
the state
son's?
pays for that, but they take all of
Okay.
his social security and then Medicaid covers the rest.
Okay. So that's the primary funding. And so that includes meals and everything for him, correct?
It's supposed to include everything, yes. But you tell me, how does $30 a month for things like, oh, you want soda, or you need new shoes, or you need, shoes are a great example. My son wears AFOs because he has foot drop on both feet. Sure, the insurance covers the AFOs, but they don't cover the shoes that are harder to find to get the foot in the shoe properly. Like,
And so you bring those into the home for him out of your expense. Is that what I'm hearing? So you
yes,
you supplement what's not covered out of your out of pocket.
right.
And
Yeah,
because you're a parent and not a child, you're not eligible for a tax credit that you could write off those expenses. Is that what I'm
I
hearing?
can at
Or
least get a $500 a year tax credit.
as a caregiver? And
Right. Yes.
so parents of children who are in institutional settings are not eligible for, is this an Illinois-based tax credit, or is this a Medicare
Federal. It's a federal
federal federal
tax credit.
caregiver tax credit for $500?
Mhm.
And so I know you do a lot of advocacy. Is this an issue you're advocating on? Can you tell us more about it?
I've
Yeah.
talked to people about it. It's not something that's on the top of my list because I'm trying to fry bigger fish. Um,
Okay.
but I have spoken with briefly with somebody from Caring Across Generations about it. Um, but even like I said, it's every component of whether you are the person with the disability or you're their caregiver, whether you're their spouse, their child, your child, whatever. This is a very broken system, even just for the person, you know. I mean, what it costs to modify a van to put a wheelchair in it is astronomical. I mean, when my son got his electric wheelchair, I was like, oh, this is great, except for I have no vehicle that can transport it. None. And, we bought actually, my parents bought it for us, a lift that went on the back, and you're supposed to drive it up on it and then roll it up and put a cover on it so the rain doesn't get it. We used it twice, and my husband's like, yeah, we're not hauling a $40,000 wheelchair on the back of this car because it's going to be down the interstate and we're going to be in the opposite direction. It's, you go look at we looked at that point, a 10 or 11-year-old van that actually cost more than a new one would have, that wasn't accessible. But don't worry, you can take this part of it off as a medical expense. So, if you're paying $105,000 as a number, 85 of it's the accessibility. You can take the 85 as a medical expense. Really?
Got it. So, because even though your son is in this home setting, you take him out, right? You're bringing him to
I take him out
your home.
regularly.
And
I'm taking him to Indianapolis this weekend.
So it's not really I think a lot of people have this misconception. I had an uncle who who had a developmental disability, a similar kind of in a state-run home in Florida, and my grandma also regularly took him out and was, favorite activity was to go to McDonald's. He loved it, and that was. I think a lot of people have this misconception that people in institutional settings don't have, still active community engagement activities and are not being part of, and they absolutely should be, right? We should be. And so those kinds of costs to you are real and necessary, right? For your son's well-being. Yeah,
right. So my son's three big expenses over the cost of a year are tattoos, because he has 9 of them, getting ready to get the 10th one next week, his coffee habit, and how many times can he send somebody to McDonald's to pick him up something to eat? Okay. And I make sure he has what he needs, but most people don't have that. And even that, I can only do that to a point. There's points I have to say, okay, yeah, no, we can't do that right now. And where you talk about, on average, it's 30% more to live with a disability, I think is the number I write out of your stuff.
Yeah, right.
That has to be a minor number, for all kinds of things, like things that people don't even think about. Like, I have caregivers in my home and whatever. Am I having to buy gloves for them? Or, little bitty things like, okay, how often am I replacing the screen door because I've caught it with my wheelchair so many times? The little things that get broken because you're squeezing a wheelchair in a place that it really wasn't meant to be. Or, shower chairs, just the list goes forever.
Let me ask you a question. Have you ever felt so squeezed by your disability related costs that you couldn't afford other essential items like food or housing, or you went into debt?
My ex-husband and I took bankruptcy because of medical bills over my son. There were points like in 2008 going into 2009, my son was in the hospital for 5.5 months. Okay. You're not really working much when your kid's in the hospital in critical condition for the bigger part of that 5.5 months. I mean, literally, my parents were paying my mortgage. My in-laws were paying my car payments, because you cannot. And there is, even anywhere that's going to give you some emergency assistance, they're going to get you through 1 month. They're not getting you through 5 months, and even especially in the adult medicine, which is much worse than pediatrics for this. Oh, you're going to be here all day with them. We're now going to charge you $25 to park. What is that? People are going to a doctor or a hospital. They're already spending money they didn't have or plan. And now let's charge them $25, $50 to park.
Yeah, wow. I think that's probably not that's a real cost a lot of people are feeling that you never hear about, right? Just the parking costs of going to a hospital is a minor thing, but if you're going to the hospital on the regular, which a lot of people do, that could really, really add up. I want to I don't want to take too much longer, so I want to get to a couple of things. One is when your son turned 18, what was that like when he was no longer a dependent and he was an adult age? How
Um,
was that transition for you?
so it transitions horribly, first of all. I mean, he was still in high school because he was a year behind from because of other stuff, but that's irrelevant. So easy, there's no book to teach you how to do it, first of all. Do you need guardianship? Do you not need guardianship? A lot of states have gone to what now is called a shared decision maker, because they don't think guardianship should be taken away, which is correct. It shouldn't. My son is his own guardian, but it was okay. We need to get POA paperwork set up. He's 37 now, so he's probably updated it 4 or 5 times over the last 15 years. It's
SSI was figured out. How was
SSI. I had already applied for him when I got divorced, so that was already in play. So if SSI for a child is based on medical and parents' income. So if it's already there, it's there. If it's not, then you start the process. And it's not an easy process by any means. It's the same process a disabled adult goes through, except for, especially somebody who winds up disabled after working 10 or 12 years and has paid in credits and all that. There's not a lot of places to help somebody with a child apply, like the organizations that you can hire for an adult, they don't exist for kids,
interesting?
let alone the so no matter how many specialists you have, some will let you stay at least until you graduate high school. Others are like, okay, you're 18, it's time to go find another adult doctor. Here you go, goodbye. And we had a doctor do that. No referral, no nothing. You got to find the doctor on your own. There is no transition care. Now, by law, the school districts are required to provide transitional care, because somebody that is in special ed with a developmental disability is entitled to stay in school until their 22nd birthday, if they choose. But in most areas, the places that give transitional care is a joke. It's, oh, well, we tried them in this work program and here's this one, but you're on your own, or there's a 7-year wait list. Or you need to fill these forms out to find out if he can move into this community setting. And that has a 10-year wait list. And what are you supposed to do in the 10 years?
So it was hard. The transition was
It
really hard.
was,
You said there was no book, there was no way to
there's no
know how to
book,
navigate it. You're muddling through.
there is, right. And then I don't know whether it's worse or better today because of being able to go online. Like I tell people all the time, do not Dr. Google things, please. Just don't. But they'll get on these parental support groups, and sometimes you get some really good advice, and other times you get somebody that has just sent you down a rabbit hole that you have no clue what you just crawled into, and you're thinking you're on the right path, and you're not.
Mm,
And
it's really really stressful.
it is very stressful, and it's just a broken system. I mean, let's just take a normal, there is no true normal, but somebody that's for some reason is just in a wheelchair. They have physical limitations that's put them in a wheelchair. They can drive, they can do everything else. But what are just those costs, which are minor comparatively to the costs and the things that I incurred? I'm in the
So
process of
yeah, yeah.
um, planning a very small conference at a small hotel in Southern Illinois, and it's in an old lodge. And that was one of my first questions. Okay, and how many ADA accessible rooms do you have? Because I know I will need at least 2 for people coming. People don't think about those things.
Yeah. So we're getting towards the end here, and I know that you do a lot of advocacy, and you said you had some big fish to fry. I don't want to leave here without hearing about your big fish. So, in terms of your advocacy, so what are the big fish that you're advocating for with respect
So
to people with disabilities?
one is two parts. So during the pandemic, all families were locked out of any kind of long-term care. And I clarify this is any kind because people did not realize we have 500 pediatric long-term care facilities in this country. And those kids didn't get to see their moms and dads either, or a big part of it. Okay. And people in 4-bed group homes didn't do. So in Illinois, I got a law passed that they can never lock me out again. In Illinois, people were allowed up to 2 essential caregivers, but we don't have a federal law yet. And this will be our third Congress that it will be introduced to. If the last Congress had lasted another probably 90 days, we could have gotten it. So we might stand a better chance, but who knows because of the world we're living in. The other one is that I'm volunteer with a group of people from all over the country that are looking at not just how do you overhaul long-term care, but how do you change it entirely? How do we get everybody to private rooms and private bathrooms? And how do we do more of community style living where whether it is the person just has a physical disability and needs some assistance, to my son who really does require skilled nursing, to a family with an adult with a disabled child that they're not ready to put somewhere else. How do we get them all living in the same community and that services are already in this community that can go to them? So they're not having to move to go to this community, to the services. We want people to be able to age in place. And it's a big thing. It's shooting for the stars. There's some legislation that's already been written to allow for demonstration projects. And we're trying to work our way through that legislation and ask for $600 million, which sounds like a lot till you realize that that is less than 0.1% of the annual Medicaid and Medicare budget.
All right.
And so when I say big fish, I mean big fish.
Yes,
so tell me, oh yes, Michelle introduced me to you.
Yes.
Okay, so I am on the board for Great Panthers in New York, by the way. I'm the vice president of the board. So how did you find us?
One of my students, Rachel, works with Great Panthers and was like, you have to talk to Great Panthers. And so I talked to Michelle. And then I said, Michelle, I'm looking to talk to people about the cost of living with a disability. And she said, you got to talk to Carrie. And so here we are. Here we are.
So I'm the one who plans our Transformation Tuesdays. I would love for you to come, explain to people, what this world is, and because people don't realize this.
Yeah, well, that's the whole point of what we're doing. So we're launching this podcast. We're gonna have a website called disabilitysqueeze.org where we're gonna ask people to share their stories, just like this, about their cost of living. It's not up yet, so nobody go to it yet. I'm still working on the website, but we're gonna share our research. We're doing a lot of research on the cost of living with a disability. And my instinct is we need research and we need stories, right? We need to combine those two. So that's really the goal of this, is to get stories and with research and to fill the void and bring this to the attention of people who need to hear it. Thank you so much for joining me, Carrie.
Oh
and
no,
I really
thank you. And please go tackle the world because there's not enough people like us willing to just raise hell.